So you decided that you need a little extra help, but you don't know who to go to. Should you go to a psychiatrist, a psychologist, a psychotherapist, or a counselor? What's the difference? Hi, I'm Patrick. I'm a professional psychotherapist and counselor, and this is Psych of Pat, a cause that wants to see people with healthier mental well-being through self-awareness and psychoeducation. If you have any questions or would you like to make a referral, you can reach me on Facebook at facebook.com/psychofpat. Links are in the description below. Give us a thumbs up and subscribe to this channel. Your subscriptions go a really long way in helping us make more videos like this. What's a psychiatrist? Basically, a psychiatrist is somebody who has a degree in medicine and specialized in psychiatry. Commonly, their perspective is that mental illnesses have a chemical component, so their treatment involves prescription medicine. They are trained to clinically diagnose using the Diagnostic and Statistical Manual for Mental Disorders, or the DSM. What's a psychologist? A psychologist is someone who has at least a master's degree in psychology. They are trained to do psychological tests as well as diagnose using the DSM. What's a psychotherapist? A psychotherapist is someone who is trained to perform talk therapy. They work generally with long-term and severe cases. While they don't clinically diagnose, they are familiar or they're knowledgeable of the DSM and they can spot symptoms. They work through your current issues by helping you understand yourself by understanding your past. What's a counselor? In some countries, the words counselor and psychotherapist mean exactly the same thing. Often the distinction is that counselors work less severe cases and are generally shorter term. They don't necessarily go into your past, but they help you with your current issues. Are there psychiatrists or psychologists or counselors who are also psychotherapists? Quick answer is, it depends. Not all psychiatrists are trained to do a specific kind of talk therapy, but there are. Some psychologists only work in the fields of assessment and research, so they aren't necessarily trained to do talk therapy. So who should I approach first? Quick answer is, it also depends. You can start out with a psychotherapist for an intake interview. An intake is when the therapist gathers biographical and background information so they could see what the appropriate next steps are. Sometimes we might recommend that you go see a psychiatrist to get a prescription medication and you could be good to go with just that. Or we could recommend that you see both a therapist and a psychiatrist at the same time. With the therapist, you can work out your issues with talk therapy, and at the same time, you can manage your chemical imbalances using prescription medication. It will always depend on your presenting problem. It seems like a lot, but all these professionals are trained to do essentially the same thing: help you. So don't be afraid to seek professional help. If you have any more questions, you can always reach out to me through Facebook. Did you learn something new today? If you did, give us a thumbs up and share this video with your family and friends. Thanks, and I'll see you next time.